Hello, everybody. My name is Joseph Jabor, and I am a PGY3 resident at Henry Ford Macomb Hospital. I am going to share my case here with you all. This is Wernicke encephalitis as a sequelae of COVID-19 infection, titled Dyschezia-Induced Nutritional Deficiency. This case is very, very interesting. It is one of a 14-year-old female who initially had presented to the emergency department with quote unquote altered mental status. She had confusion, ataxia, and changes in speech that was initially noted in the emergency department. Ultimately, the patient was identified to have previously a COVID-19 infection that had left her with dyschezia. As a result of that, the patient had stopped eating and had soon, probably over a 3-week time, had developed thiamine deficiency, and then went on to develop Wernicke encephalitis as a result of that. Now, it took quite a while to come to that conclusion. She had a very prolonged hospital course, which required pediatric ICU admission. Upon her initial presentation to the emergency department, she had actually had an unremarkable workup, including labs, including a CT of her head. Ultimately, a few days after her initial admission, she had had both neurologic and respiratory and hemodynamic failure, which then required admission to the ICU, requiring pressors, intubation, EEG monitoring, multiple MRIs. Ultimately, after getting a little bit more history from the parents, concurrent with the MRI findings that we had for her, which you can see there in these images, we were able to come to a conclusion of Wernicke encephalitis as a cause of her altered mental status. Now, this diagnosis was confirmed through history taking. It was confirmed through MRI imaging. As you can see here in the middle, some classic images associated with this diagnosis. And then lastly, lab values, where once the suspicion was raised, we drew a thiamine level, which was well below, it was actually at 20, the normal range, which is typically between 70 and 180. So ultimately, the patient ended up getting high dose thiamine. She had some level of neurologic recovery, full respiratory, full hemodynamic recovery, and she ended up being discharged to an inpatient rehab facility. So a very interesting case. Typically you think of Wernicke's associated with alcoholism. This is one seen in nutritional deficiency in a pediatric, otherwise normal patient, and it serves to broaden the differential of a patient presenting to the emergency department with altered mental status, with a prior history of COVID-19. You think to yourself, okay, perhaps this, the patient developed dyschezia. Perhaps, they could have some level of nutritional deficiency and thus Wernicke encephalopathy. Thank you so much.